everyone, it's Dr. Mike here. Welcome back to the channel. Today we're diving deep into a topic that's crucial for your health: blood sugar. More specifically, we're going to unravel 16 alarming signs of high blood sugar and 8 common symptoms of diabetes. Now, you might be wondering why this is so important. Well, maintaining healthy blood sugar levels is absolutely vital for your overall well-being. When your blood sugar is consistently high, it can lead to a range of health complications, some of which can be quite serious. We're going to break down each sign and symptom, explaining exactly what happens in your body and why it occurs. By recognizing these early warning signs, you can take proactive steps to manage your blood sugar levels and prevent potential health issues down the line. So, if you're ready to learn how to take control of your health and potentially spot trouble before it becomes a major problem, stick around. Let's get started. Alright, let's jump right into our first sign of high blood sugar: frequent urination, especially at night. Now this might seem like a strange connection, but trust me, it makes sense. You see, when your blood sugar levels are high, your body works hard to flush out that excess glucose, and one of the main ways it does that is through your urine. Think of your kidneys like little filters working overtime to remove the excess sugar. As your kidneys filter out the sugar, they also pull out more water from your body. This leads to an increase in urine production, making you need to pee more often, even disrupting your sleep with those nighttime bathroom trips. So, if you're noticing a sudden increase in how often you're going to the bathroom, especially if it's happening at night, it's definitely worth paying attention to. It could be a sign that your blood sugar levels are out of whack. Let's move on to our second sign of high blood sugar: increased thirst, also known as polydipsia. You know that feeling when you just can't seem to quench your thirst, no matter how much water you drink? That can be a telltale sign of elevated blood sugar levels. Here's why. Remember how we talked about your kidneys working overtime to flush out excess glucose through your urine? Well, that process also dehydrates your body. Your body is smart, and it knows it needs to replenish those fluids, so it sends out signals to your brain telling you to drink more. Think of it like this. High blood sugar creates a kind of internal imbalance, and your body tries to restore equilibrium by prompting you to drink more fluids. This is its way of diluting the high concentration of sugar in your bloodstream. So, if you're constantly reaching for your water bottle and feeling parched, don't just brush it off. It could be your body trying to tell you something important about your blood sugar levels. Alright guys, let's talk about unexplained weight loss as a potential sign of high blood sugar. It might seem counterintuitive, right? But here's the deal. When your blood sugar is consistently high, your body's cells aren't getting the glucose they need for fuel. Think of it like this: your cells are starving even if you're eating enough. So what does your body do when it's in a bind? It looks for alternative energy sources. And where does it find them? You guessed it, your muscle and fat stores. Your body starts breaking down these tissues for energy, leading to weight loss, even if you haven't made any conscious changes to your diet or exercise routine. Now, it's important to remember that weight loss can be caused by a variety of factors, and it's not always a red flag for high blood sugar. But if you're noticing significant, unexplained weight loss, especially in conjunction with other symptoms we've discussed, it's crucial to get your blood sugar checked. Early detection is key when it comes to managing your health. Don't hesitate to reach out to a healthcare professional if you have any concerns. Your health is worth it. Let's talk about extreme hunger, or as we doctors like to call it, polyphagia. It's a common symptom of high blood sugar, and it might seem counterintuitive at first. You're thinking, high blood sugar means high glucose, right? Shouldn't that make me feel full? Well, here's the catch. Even though there's plenty of glucose circulating in your bloodstream, it's not reaching your cells effectively. Remember, insulin is like the key that unlocks your cells and lets glucose in. But with high blood sugar, that key isn't working properly, leaving your cells starved for energy. And what happens when your cells are hungry? They send signals to your brain screaming for more fuel. This constant hunger can be incredibly frustrating and difficult to ignore, leading to increased food intake and potential weight gain. It's a vicious cycle. High blood sugar prevents glucose from reaching your cells, triggering intense hunger, which can then lead to even higher blood sugar levels if not managed properly. Let's talk about fatigue. We've all experienced it, that feeling of being constantly drained no matter how much sleep you get. But did you know that persistent fatigue can actually be a sign of high blood sugar? Remember how we talked about glucose being the primary fuel for your cells? Well, when your cells aren't getting the glucose they need due to high blood sugar, it's like trying to run your car on fumes. Your body is simply running low on energy, leading to that feeling of constant exhaustion. And it's not just your cells that are affected. High blood sugar can also disrupt your sleep patterns, making it difficult to get a good night's rest. This can create a vicious cycle. High blood sugar disrupts your sleep, leaving you feeling even more fatigued the next day. It's important to remember that fatigue can be caused by a variety of factors, so it's crucial to pay attention to your body and any other symptoms you might be experiencing. We're talking high blood sugar, and guys, this stuff can really mess with your vision. You see, when your blood sugar's high for a while, it starts to damage those tiny blood vessels in your eyes. We're talking about the ones feeding your retinas, the back part of your eye that lets you see. And get this, those blood vessels are super delicate, like the finest threads. Damaged blood vessels, well, they don't work so well. They can leak, swell up, and that messes with how clearly you see. It's like trying to watch your favorite show on a TV with a fuzzy signal. Now, in the beginning, you might not even notice a problem, but over time, that blurred vision can get worse. You might have trouble focusing, seeing at night, or making out colors. Trust me, you don't want to mess around with your eyesight. If you notice any sudden changes in your vision, don't wait. Get yourself to an eye doctor ASAP. Ever notice how a small cut seems to take forever to heal when your blood sugar's been out of whack? Well, there's a reason for that. High blood sugar can seriously slow down your body's natural healing process. It's like hitting the brakes on your body's repair crew. Here's the deal. High blood sugar messes with your blood circulation, making it harder for those healing nutrients and oxygen to reach your wounds. And if that wasn't enough, high blood sugar also weakens your immune system, those tiny soldiers in your body that fight off infections. So, we've talked about how high blood sugar can turn even a minor cut into a major healing drama. But did you know it can also make you a magnet for infections? It's true. High blood sugar is like lowering the shields on your body's defense system, making it easier for those nasty germs to invade. Here's why. High blood sugar weakens your white blood cells, those brave little soldiers that usually patrol your body and fight off infections. Think of them as your body's own personal army. But with high blood sugar, they're like an army low on supplies struggling to do their job. And to make matters worse, high blood sugar also creates the perfect breeding ground for bacteria and fungi. They thrive in environments with excess sugar. It's like rolling out the red carpet for these unwanted guests. So if you're constantly battling skin infections, urinary tract infections, UTIs, yeast infections, or any kind of infection, it's a sign that your blood sugar might be out of whack. Have you ever experienced a tingling sensation in your hands or feet, like pins and needles? Or maybe a feeling of numbness, like a part of your limb is asleep? While these symptoms can be harmless and temporary, they can also be a sign of nerve damage, especially if they persist. This is particularly concerning if you have high blood sugar. High blood sugar over time can damage the delicate nerves throughout your body, particularly those in your extremities like your hands and feet. This condition is known as diabetic neuropathy, and those tingling, numb sensations, they're often the first warning signs. Now you might be thinking, okay, but how does high blood sugar damage my nerves? Well, imagine your nerves are like electrical wires, responsible for transmitting signals throughout your body. High blood sugar is like pouring syrup on those wires. It interferes with their ability to send those signals clearly and efficiently. Over time, this interference can lead to nerve damage, causing those uncomfortable and sometimes painful sensations. Diabetic neuropathy is a serious complication, and it's crucial to catch it early. So if you're experiencing persistent tingling or numbness, especially if you have risk factors for high blood sugar, don't ignore it. Schedule a visit with your doctor. We often think about the impact of sugar on our teeth, but did you know that high blood sugar can also wreak havoc on your gums? You see, Our mouths are home to a whole ecosystem of bacteria, and high blood sugar creates the perfect environment for the bad guys to thrive. When your blood sugar levels are elevated, it's like providing an all-you-can-eat buffet for those harmful bacteria in your mouth. They feast on the sugar, multiply rapidly, and release acids that attack your gums, leading to inflammation and infection. This is why people with high blood sugar are more susceptible to gum disease, also known as periodontal disease. Now you might be wondering, okay, but what does gum disease actually look like? Well, some common signs include red, swollen, and tender gums that bleed easily, especially when brushing or flossing. You might also notice persistent bad breath, receding gums, loose teeth, or even pus around your gums. Gum disease isn't just a minor inconvenience. If left untreated, it can lead to tooth loss and even increase your risk of other serious health conditions like heart disease and stroke. That's right, the health of your mouth is directly connected to the health of your entire body. Have you ever noticed that when your blood sugar is high, you tend to feel thirstier than usual? This isn't a coincidence. High blood sugar actually messes with your body's delicate fluid balance, leading to dehydration. And one of the first places you might notice this dehydration is in your mouth and skin. Think of it this way: when your blood sugar levels rise, your kidneys, which are responsible for filtering waste products from your blood, go into overdrive trying to flush out the excess sugar. This means producing more urine, which in turn leads to increased fluid loss and dehydration. Now, as your body becomes dehydrated, it starts pulling moisture from other areas, like your mouth and skin, to compensate. This can result in that uncomfortable dry mouth sensation, also known as xerostomia. You might notice your mouth feels sticky or parched, you have difficulty swallowing, or your voice sounds hoarse. And it's not just your mouth that suffers. Your skin, the largest organ in your body, also relies on adequate hydration to stay healthy and supple. Have you ever noticed how your mood can swing when you're really hungry? It's not just you. This phenomenon is so common that it even has a name: hangry, a blend of hungry and angry. But why does this happen? What is it about hunger that can turn a perfectly pleasant person into someone irritable and short-tempered? Blood sugar fluctuations can have a real impact on your mood. When you eat, your body breaks down food into glucose, which is then released into your bloodstream. This glucose is essential because it serves as the primary fuel for your brain and body. However, the levels of glucose in your blood don't remain constant. They fluctuate based on what and when you eat. When your blood sugar is high, your body tries to deal with it quickly, sometimes overcompensating and causing your blood sugar to drop too low, too fast. This rapid fluctuation can be jarring for your system. Imagine driving a car that suddenly accelerates and then brakes sharply. It's not a smooth ride, and it can be quite stressful. This can leave you feeling irritable, agitated, or even anxious. Your body is essentially sending out distress signals, and your mood is one of the first things to be affected. You might find yourself snapping at people or feeling overwhelmed by minor inconveniences. It's like your body and brain are running on fumes and nobody is happy about it. When your blood sugar is low, your brain struggles to function optimally. This can make you feel tired, sluggish, and mentally drained. It's a state that can make even the simplest tasks seem insurmountable. Think about it. Your brain is a high-performance organ that relies on a steady supply of glucose for energy. Just like a car needs fuel to run, your brain needs glucose to perform its myriad functions, from processing information to regulating emotions. When that supply is erratic, your brain's ability to function properly is compromised. This can lead to a range of cognitive issues, including difficulty concentrating, memory lapses, and impaired decision-making. It's as if your brain is trying to operate on a low battery. This can manifest as difficulty concentrating, brain fog, and yes, even those mood swings we were talking about. Brain fog is a common symptom of low blood sugar, characterized by a feeling of mental cloudiness and confusion. It's hard to think clearly or stay focused when your brain is starved for energy. It's important to remember that these mood changes are often a physiological response, not a personal failing. Understanding the root cause can help you manage your symptoms more effectively. It's not about willpower or self-control, it's about giving your body the fuel it needs to function properly. Now, it's not just about feeling hangry. The impact of blood sugar fluctuations goes beyond temporary irritability. Chronic instability in blood sugar levels can have long-term effects on your mental and physical health. These blood sugar swings can contribute to a vicious cycle. When you're feeling irritable, you might be more likely to reach for sugary snacks or comfort foods, which can further exacerbate the problem. These foods cause a rapid spike in blood sugar, followed by a sharp drop, perpetuating the cycle of mood swings and irritability. When you're feeling irritable, you might be more likely to reach for sugary snacks or comfort foods, which can further exacerbate the problem. It's a quick fix that provides temporary relief, but ultimately leads to more significant issues. The more you rely on these quick fixes, the more unstable your blood sugar levels become, making it harder to break the cycle. That's why it's crucial to break the cycle by managing your blood sugar levels through a balanced diet, regular exercise, and proper medical care if needed. Eating balanced meals that include a mix of protein, healthy fats, and complex carbohydrates can help stabilize your blood sugar levels. Regular physical activity also plays a crucial role in maintaining stable blood sugar levels and improving overall mood. If you're experiencing frequent irritability or mood swings, it's worth having a conversation with your doctor. They can help you identify any underlying issues and develop a plan to manage your symptoms. This might include dietary changes, exercise recommendations, or even medical interventions if necessary. Taking proactive steps to manage your blood sugar levels can significantly improve your mood and overall well-being. Have you ever noticed dark, velvety patches of skin on your body, particularly in areas like your neck, armpits, or groin? While these patches, known as acanthosis nigricans, are often harmless, they can sometimes be a sign of an underlying health condition, including insulin resistance. Insulin is a crucial hormone that helps your body use glucose for energy. When your body becomes resistant to insulin, it means your cells aren't responding to it as well as they should, leading to elevated blood sugar levels. Acanthosis nigricans is thought to be linked to this excess insulin in the bloodstream. Now, it's important to emphasize that not everyone with acanthosis nigricans has insulin resistance or diabetes. Other factors, such as genetics, obesity, hormonal disorders, and certain medications, can also contribute to its development. However, if you notice these dark patches on your skin, it's essential to consult with a healthcare professional to rule out any potential underlying health concerns. We often associate nausea and vomiting with stomach bugs or food poisoning. But did you know that high blood sugar can also wreak havoc on your digestive system? When blood sugar levels skyrocket, it can interfere with the normal functioning of your stomach and intestines, leading to a whole host of unpleasant symptoms. One way high blood sugar disrupts digestion is by slowing down gastric emptying. This means that food sits in your stomach for longer than it should, increasing the likelihood of feeling nauseous or even throwing up. Imagine your stomach as a train station, and high blood sugar is causing delays and backups on the tracks. Nothing is moving smoothly. Additionally, high blood sugar can damage the nerves that control your digestive system, a condition known as gastroparesis. These nerves are responsible for coordinating the movement of food through your digestive tract, and when they're not functioning properly, it can lead to a whole cascade of problems including nausea, vomiting, bloating, and abdominal pain. It's important to note that experiencing nausea and vomiting doesn't automatically mean your blood sugar is high. These symptoms can be caused by a wide range of factors. However, if you're experiencing these symptoms alongside other signs of high blood sugar, such as excessive thirst, frequent urination, or unexplained weight loss, it's essential to seek medical attention promptly. Have you ever noticed your breath smelling fruity, almost like sweet acetone? It's a peculiar sensation, isn't it? You might be wondering what could possibly cause such an unusual scent. Believe it or not, this seemingly random symptom can be a sign of dangerously high blood sugar, specifically a condition called diabetic ketoacidosis, or DKA for short. This condition is not just a minor inconvenience, it can be life-threatening if not addressed promptly. Now, DKA is a serious metabolic complication of diabetes that occurs when your body doesn't have enough insulin to use glucose for energy. Insulin is a hormone that helps your cells absorb glucose from your bloodstream, providing them with the energy they need to function properly. As a result, your body starts breaking down fat for fuel, which produces ketones. Ketones are acidic chemicals that can accumulate in your blood and urine when your body starts using fat instead of glucose for energy. When these ketones build up in your bloodstream, they can lead to a whole host of problems, including that telltale fruity breath. This fruity odor is often compared to the smell of nail polish remover, which is due to the presence of acetone, a type of ketone. Think of it like this. Your body is basically running on emergency backup power, and those ketones are the exhaust fumes. Just like a generator might produce smoke when it's running, your body produces ketones when it's burning fat for energy. Now you might be thinking, okay, fruity breath, that's weird, but is it really that serious? It's easy to dismiss such a symptom as a minor oddity, but in the context of diabetes it can be a red flag, and the answer is a resounding yes. DKA is a medical emergency and requires immediate attention. If left untreated, it can lead to severe dehydration, swelling in the brain, and even coma or death. DKA is a medical emergency and requires immediate attention. The sooner you recognize the symptoms and seek help, the better the chances of preventing serious complications. If you or someone you know experiences fruity breath along with other symptoms like excessive thirst, frequent urination, nausea, vomiting, abdominal pain, or difficulty breathing, it's crucial to seek medical help immediately. These symptoms indicate that your body is struggling to manage its blood sugar levels and needs urgent care. Remember, early detection and treatment are key to preventing serious complications from DKA. Healthcare professionals can administer insulin and fluids to help stabilize your condition and bring your blood sugar levels back to normal. So, pay attention to your body's signals, even the seemingly strange ones like fruity breath, because they might be trying to tell you something important. Your body has a way of communicating when something is wrong, and it's up to you to listen and take action. It's important to note that not everyone with fruity breath has DKA. There are other conditions that can cause a similar symptom, such as certain diets or metabolic disorders. However, if you have diabetes or are at risk for diabetes, it's especially important to be vigilant. Educating yourself about the potential causes of fruity breath can help you make informed decisions about your health. Knowledge is power, and understanding the signs and symptoms of DKA can be life-saving. Support groups and educational resources can also be valuable tools in managing diabetes and preventing complications like DKA. Connecting with others who have similar experiences can provide emotional support and practical advice. Regular monitoring of your blood sugar levels is crucial in managing diabetes. Keeping track of your readings can help you and your healthcare provider make necessary adjustments to your treatment plan. A balanced diet and regular exercise are also important components of diabetes management. Eating a variety of nutritious foods and staying active can help keep your blood sugar levels stable and reduce the risk of complications. If you are prescribed insulin or other medications, it's important to take them as directed by your healthcare provider. Proper medication management is essential in preventing DKA and maintaining overall health. Regular checkups with your healthcare provider are also important. These appointments allow for ongoing monitoring of your condition and adjustments to your treatment plan as needed. Taking proactive steps to manage your diabetes can help you live a healthy, fulfilling life. By staying informed and vigilant, you can reduce the risk of complications and enjoy peace of mind. Sharing information about DKA and its symptoms with friends and family can also be beneficial. The more people who are aware of the signs, the better prepared they will be to help in an emergency. Wearing a medical alert bracelet can provide critical information to first responders in case of an emergency. This simple step can make a significant difference in getting the right care quickly. In conclusion, while fruity breath might seem like a minor or even amusing symptom, it can be a serious indicator of diabetic ketoacidosis. By understanding the causes and recognizing the signs, you can take action to protect your health and well-being. Always consult with your healthcare provider if you have any concerns about your symptoms. They are your best resource for guidance and support in managing your health. Stay informed, stay vigilant, and take charge of your health. Your body is always communicating with you, and it's up to you to listen and respond appropriately. For more information and support, reach out to diabetes organizations and healthcare providers. They can offer valuable resources and assistance in managing your condition. Remember, you have the power to take control of your health and live a fulfilling life. Stay proactive, stay informed, and take care of yourself. Now let's talk about another symptom that might seem unrelated to blood sugar levels but can actually be a warning sign: shortness of breath. You might associate it with strenuous exercise or respiratory issues, but high blood sugar can also make it hard to catch your breath. High blood sugar can impact your breathing in a few different ways. Firstly, it can lead to a condition called diabetic acidosis, which we discussed earlier. When your body doesn't have enough insulin to use glucose for energy, it starts breaking down fat for fuel, producing ketones as a byproduct. These ketones can build up in your blood, making it more acidic and disrupting the normal balance of kislotno-alkalinea in your body. This imbalance can affect your lungs' ability to exchange oxygen and carbon dioxide efficiently, leading to shortness of breath. Secondly, high blood sugar can damage blood vessels, including those in your lungs. This damage can reduce blood flow to the lungs, making it harder for them to get the oxygen they need to function properly. Thirdly, high blood sugar can weaken your immune system, making you more susceptible to respiratory infections. These infections can further compromise your lung function and worsen shortness of breath. Have you noticed your appetite increasing even though you're eating regular meals? While there are many reasons for a sudden surge in hunger, it could be a sign of diabetes, specifically a condition called polyphagia. Polyphagia is the medical term for excessive hunger or increased appetite that's out of your control. It's one of the classic symptoms of diabetes, along with excessive thirst, polydipsia, and frequent urination, polyuria. But why does diabetes cause increased hunger? Well, here's the science behind it. In a nutshell, diabetes affects how your body uses glucose, which is a type of sugar that serves as your body's primary source of energy. When you eat, your body breaks down carbohydrates from food into glucose, which then enters your bloodstream. This signals your pancreas to release a hormone called insulin. Think of insulin as a key that unlocks the doors of your cells, allowing glucose to enter and be used for energy. However, in diabetes, either your pancreas doesn't produce enough insulin or your cells become resistant to it. This means that glucose can't enter your cells efficiently, leading to a buildup of sugar in your bloodstream, a condition called hyperglycemia. Alright, let's talk about frequent urination, a common symptom of diabetes. When your blood sugar is high, your kidneys work overtime. They're like the filters in your body, constantly cleaning your blood. But with diabetes, there's too much glucose, a type of sugar, in your bloodstream. Your kidneys struggle to keep up and end up filtering out some of that excess glucose into your urine. Think of it like this. Imagine your kidneys are like sieves, separating impurities from water. With high blood sugar, it's like pouring sugary drinks through the sieve. The sieve can handle some sugar, but eventually it gets overwhelmed and some of that sugar slips through. That's what happens in your kidneys. The excess sugar in your urine draws in more water, leading to increased urine production and those frequent trips to the bathroom, especially at night. Now, we all pee more at night, but for people with diabetes, it can be disruptive to their sleep. This symptom, along with others we've discussed, should never be ignored. Blurry vision is another sign you shouldn't ignore, especially if you suspect diabetes. High blood sugar can damage the tiny blood vessels in your eyes, a condition called diabetic retinopathy. You see, these blood vessels are responsible for nourishing the retina, the back part of your eye that senses light and sends signals to your brain to create images. When these blood vessels are damaged, they can leak fluid or bleed, affecting the retina's ability to function properly. This can lead to blurry vision, floaters, or even vision loss if left untreated. Imagine looking through a window that's slowly fogging up. That's kind of what happens with diabetic retinopathy. Have you noticed cuts or sores taking longer to heal than usual? This could be another sign of high blood sugar and diabetes. High blood sugar creates a less than ideal environment for your body to heal properly. Here's the deal. High blood sugar levels can damage your blood vessels and nerves, including those responsible for carrying oxygen and nutrients to your tissues. Without proper blood flow, wounds don't receive the essential building blocks they need to heal efficiently. It's like trying to build a house without enough bricks and mortar. It's going to take a lot longer, and the results might not be as strong. On top of that, high blood sugar can suppress your immune system, making it harder for your body to fight off infections that can delay wound healing. It's like having a weakened defense system, making you more susceptible to invaders that can slow down the healing process. Hey everyone, Dr. Mike here. Today we're diving deep into a topic that might catch you off guard: unexplained weight loss. This is a symptom that can be quite alarming, especially when it happens without any changes to your diet or exercise routine. We're continuing our deep dive into the signs and symptoms of high blood sugar, and today we're tackling a symptom that might seem like a positive at first glance: unexplained weight loss. You might think, hey, losing weight without trying, that sounds great, but hold on, it's not as simple as it seems. Now don't get me wrong, losing weight can be a good thing, especially if you're overweight or obese. Regular exercise and a balanced diet are key components of a healthy lifestyle. But when weight loss happens without any effort, it can be a sign that something is seriously wrong. But when those pounds start dropping without any changes to your diet or exercise routine, that's a major red flag that something's not right. Unexplained weight loss can be a symptom of various health issues, including high blood sugar, hyperthyroidism, and even cancer. So, why does high blood sugar lead to weight loss? It's a question that puzzles many. The answer lies in the way our bodies process glucose, which is the primary source of energy for our cells. Well, it all boils down to how your body uses glucose, its primary source of energy. When everything is functioning normally, insulin helps glucose enter your cells, where it's used for energy. But when you have high blood sugar, your body can't use glucose effectively. When your blood sugar is consistently high, your body struggles to use glucose effectively. This is often due to insulin resistance or a lack of insulin production, which are common in conditions like type 2 diabetes. This forces your cells to look for alternative fuel sources, and guess what they turn to? When glucose isn't available, your body starts breaking down muscle and fat to get the energy it needs. You got it, muscle and fat. While this might sound like a good thing initially, especially if you're trying to lose weight, it's actually quite harmful. Losing muscle mass can weaken your body and make it harder to perform everyday activities. Now this might sound like a good thing initially, but trust me, it's not. Rapid weight loss, especially when it involves muscle loss, can lead to a host of other problems, including fatigue, weakness, and a compromised immune system. Losing muscle mass can weaken you and make it harder to maintain a healthy weight in the long run. It can also make you more susceptible to injuries and reduce your overall quality of life. Plus, this type of weight loss isn't sustainable and can often be a sign of a more serious underlying condition like diabetes. If left untreated, high blood sugar can lead to severe complications, including nerve damage, kidney disease, and cardiovascular issues. So, if you're noticing the numbers on the scale going down without any explanation, don't just brush it off. It's crucial to pay attention to your body and recognize when something is off. Unexplained weight loss is your body's way of signaling that something isn't right. Make an appointment with your doctor to get your blood sugar checked and rule out any underlying medical conditions. Early detection and treatment can make a significant difference in managing your health and preventing complications. It's also a good idea to educate yourself about the symptoms of high blood sugar and other related conditions. Knowledge is power, and understanding what's happening in your body can help you take proactive steps to maintain your health. In addition to seeking medical advice, consider making lifestyle changes that can help manage your blood sugar levels. Eating a balanced diet, exercising regularly, and monitoring your blood sugar can all contribute to better health outcomes. Stress management is another crucial aspect. High stress levels can affect your blood sugar and overall health. Practices like meditation, yoga, and deep breathing exercises can help you manage stress effectively. If you're diagnosed with high blood sugar or diabetes, your doctor may prescribe medication to help manage your condition. It's important to follow your treatment plan and take your medications as directed. Support is also essential. Whether it's from family, friends, or a support group, having a network of people who understand what you're going through can make a big difference in managing your condition. Remember, unexplained weight loss is not something to ignore. It's a sign that your body needs attention. By taking action and seeking medical advice, you can address the underlying issue and work towards better health. Stay informed, stay proactive, and take care of your health. Thanks for watching, and until next time, stay healthy and stay safe. Let's talk about another common symptom of high blood sugar that can really drain your energy: fatigue. We're not talking about the kind of tiredness you feel after a long day or a tough workout. This is a persistent, overwhelming exhaustion that can make even the simplest tasks feel impossible. But what's the link between high blood sugar and this constant state of fatigue? Well, remember how we talked about your body using glucose for energy? When your blood sugar is consistently high, your cells can't efficiently access and utilize that glucose. It's like trying to fuel a car with the wrong type of gasoline. It just won't run smoothly. This inefficient energy production leaves you feeling sluggish and worn out, even if you're getting enough sleep. And to make matters worse, high blood sugar can also disrupt your sleep patterns, leading to insomnia and further exacerbating your fatigue. We've all been hangry before, right? That feeling when your blood sugar drops and suddenly you're ready to snap at anyone who looks at you sideways. Well, imagine that feeling amplified, and you'll have an idea of how mood swings can be a real struggle with diabetes. You see, when your blood sugar levels are constantly fluctuating, it can wreak havoc on your mood. It's like your emotions are on a roller coaster ride, and you never quite know where you'll end up next. One minute you might be feeling fine, and the next you're overcome with a wave of irritability or even anger. These mood swings can be frustrating, both for the person experiencing them and for their loved ones. It's important to remember that these mood changes aren't intentional. They're a direct result of the physiological changes happening in the body due to diabetes. So if you're living with diabetes and find yourself struggling with mood swings, know that you're not alone. It's a common symptom, and there are ways to manage it. We'll talk about some strategies for keeping those blood sugar levels stable and those mood swings in check. Alright, let's tackle high blood pressure, another serious condition that often goes hand in hand with diabetes. The good news is, we've got a whole arsenal of treatments to help you manage it, starting with the power of lifestyle changes. First up, let's talk about diet. Reducing your sodium intake is crucial. Aim for less than 2,300 milligrams per day, and even lower if your doctor recommends it. That means cutting back on processed foods, restaurant meals, and those salty snacks that can sneak their way into your diet. Next, let's get moving. Regular physical activity is like medicine for your heart. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Think brisk walking, cycling, swimming, or even dancing, whatever gets your heart pumping and makes you break a sweat. And don't forget about stress management. Chronic stress can contribute to high blood pressure, so finding healthy ways to cope is essential. Consider techniques like yoga, meditation, deep breathing exercises, or spending time in nature. These lifestyle changes might seem simple, but trust me, they're incredibly powerful. By making these changes, you're not only managing your blood pressure, you're also improving your overall health and well-being. We've covered a lot of ground today, from the subtle signs of high blood sugar to the importance of managing diabetes and high blood pressure. Remember, knowledge is power when it comes to your health. If you found this information helpful, give this video a thumbs up and share it with your friends and family. Let's spread awareness about these important health topics and support each other on our journeys to wellness. We're thrilled to have you here with us today. Today, we're diving into a fascinating and important health topic that affects millions of people around the world. Hypotension, or low blood pressure. It's a condition that often flies under the radar but can have significant impacts on your health. You hear us talk about high blood pressure all the time, but did you know that low blood pressure can be just as serious? It can lead to dizziness, fainting, and even shock in severe cases. We'll be taking a close look at what causes hypotension, including factors like dehydration, heart problems, and endocrine issues. We'll also explore what you can do about it, from lifestyle changes to medical treatments. Knowledge is power, and by understanding your body better, you can take control of your health and well-being. We'll provide you with practical tips and advice that you can use in your daily life. We'll be breaking it down into simple terms that everyone can understand. No medical jargon here, just clear and concise information that you can use. So, if you're ready to learn something new and empower yourself with vital health information, stick around. We have a lot of great content lined up for you. This is information you can use to improve your life and the lives of your loved ones. Let's get started on this journey to better health together. Before we jump into the causes of hypotension, let's make sure we're all on the same page about what it actually is. Understanding the basics will help us grasp the more complex aspects later on. You've probably heard of blood pressure, but what does it mean? Blood pressure is a vital sign that indicates the health of your cardiovascular system. In simple terms, blood pressure is the force of your blood pushing against the walls of your arteries. This force is generated by the heart as it pumps blood into the arteries and throughout the body. Think of it like the pressure in a garden hose when the water's turned on. Just as water pressure is needed to push water through the hose, blood pressure is needed to push blood through your arteries. This pressure is essential for circulating blood throughout your body, delivering oxygen and nutrients to your cells. Without adequate blood pressure, your organs and tissues wouldn't receive the necessary nutrients and oxygen to function properly. Now, hypotension occurs when this pressure is too low, typically below 90/60 millimeters of mercury. This can lead to symptoms like dizziness, fainting, and fatigue. While some people naturally have lower blood pressure without any problems, for others, it can signal an underlying health condition that needs attention. It's important to monitor and understand your blood pressure readings to maintain overall health and well-being. One of the most common and easily remedied causes of hypotension is dehydration. You've probably heard it a million times: drink plenty of water, but there's a good reason for that. When you're dehydrated, your body loses more fluids than it's taking in. This fluid loss can lead to a decrease in blood volume, which in turn lowers your blood pressure. Think of it like a hose with less water running through it. The pressure decreases. Dehydration can sneak up on you, especially during hot weather, after exercise, or if you're not drinking enough fluids throughout the day. Symptoms can include thirst, fatigue, dizziness, and headache. Your heart is the engine that drives your circulatory system, so it makes sense that problems with your heart can lead to hypotension. Just like a car engine that's not firing on all cylinders, a heart that's not working efficiently can impact your blood pressure. Conditions like a slow heart rate or bradycardia, heart valve problems, or a weakened heart muscle known as heart failure can all contribute to low blood pressure. These conditions can disrupt your heart's ability to pump blood effectively, reducing the pressure within your arteries. If you experience symptoms like dizziness, fainting, chest pain, or shortness of breath, especially in conjunction with low blood pressure, it's crucial to seek medical attention immediately. Section 5. Endocrine issues. The hormone connection. Ever heard of the endocrine system? It's a fascinating and complex network within our bodies. It's like the body's internal communication network, using hormones to regulate a wide range of bodily functions including blood pressure, metabolism, growth, and even mood. When this system is out of whack, it can throw your blood pressure out of balance too. This imbalance can lead to either high or low blood pressure, both of which can have serious health implications. Conditions like Addison's disease, which affects your adrenal glands, can disrupt the production of essential hormones. Similarly, hypothyroidism, an underactive thyroid, can lead to a decrease in hormone production. These hormonal imbalances can result in hypotension or low blood pressure, which can cause symptoms like dizziness, fainting, and fatigue. These glands play a vital role in regulating blood pressure, ensuring that your body functions smoothly. And when they're not functioning properly, it can cause your pressure to drop, leading to a range of health issues. It's all about that delicate balance in your body. Maintaining this balance is crucial for overall health and well-being. When hormones are off kilter, it can have a ripple effect on various systems, including your cardiovascular system. This can lead to complications such as heart disease, stroke, and other cardiovascular issues. Understanding the hormone connection is key to managing and preventing these health problems. Regular checkups and consultations with healthcare professionals can help keep your endocrine system in check. Additionally, maintaining a healthy lifestyle, including a balanced diet and regular exercise, can support your endocrine health and overall well-being. So take care of your hormones and they will take care of you. Section 6. Septicemia, a serious concern. Septicemia, also known as sepsis, is a serious bloodstream infection that can cause a life-threatening drop in blood pressure. This occurs when your body's immune response to an infection triggers widespread inflammation, leading to blood vessel dilation and leakage. As your blood vessels widen, the space within them increases, while the volume of blood remains the same. This can cause a dramatic drop in blood pressure known as septic shock, which can be fatal if not treated immediately. Septicemia is a medical emergency that requires prompt treatment with antibiotics and intravenous fluids to raise blood pressure and fight the infection. Section 7, blood loss, internal and external. This one might seem obvious, but it's important to cover. When you lose blood, whether through an injury, surgery, or internal bleeding, your blood volume decreases. And just like with dehydration, less blood volume means less pressure within your arteries. Internal bleeding, which can be caused by a variety of factors like ulcers, aneurysms, or certain cancers, can be particularly dangerous because it's not always immediately apparent. If you experience sudden weakness, dizziness, fainting, or abdominal pain, it's crucial to seek medical attention right away. Remember, early detection and treatment are key to preventing serious complications from both internal and external bleeding. Section 8, putting it all together. So, we've covered a lot of ground today, folks. We've learned that hypotension, or low blood pressure, can be caused by a variety of factors, from dehydration to heart problems to serious infections. The important thing to remember is that while some cases of low blood pressure are harmless, others can be indicative of a more serious underlying condition. That's why it's so important to pay attention to your body and be aware of the symptoms of hypotension. If you experience frequent or severe drops in blood pressure, don't hesitate to talk to your doctor. They can help determine the cause of your hypotension and recommend the best course of treatment. Section 9, join the health revolution. Well, that's it for today's show. I hope you found this information helpful and empowering. Remember, knowledge is power, and the more you know about your body, the better equipped you are to take control of your health. If you enjoyed this episode and found it informative, please give it a thumbs up and subscribe to our channel for more health and wellness tips. And don't forget to share this valuable information with your friends and family. Until next time, stay healthy and keep those blood pressure numbers in check. I'm Sanjay Gupta. Today we're going to delve into a health topic that affects millions: hypertension. Whether you've experienced it firsthand or know someone who has, understanding hypertension is crucial for maintaining well-being. So let's get started. Hypotension, or low blood pressure, might sound less scary than its counterpart, hypertension, high blood pressure, but it can be just as serious. While high blood pressure strains your arteries, low blood pressure means your body isn't getting enough blood flow. This can lead to a range of symptoms, some subtle and some quite alarming. Stay tuned as we break down everything you need to know about hypertension. In simple terms, hypotension is when your blood pressure reading is lower than 90/60 millimeters of mercury. Blood pressure is the force of blood pushing against your artery walls. When this force is too low, your vital organs may not receive enough oxygen and nutrients. This can disrupt their normal function and lead to a variety of symptoms. One of the most common signs of hypotension is dizziness or lightheadedness, especially when standing up quickly. This happens because your blood pressure temporarily drops, and your brain doesn't get enough blood flow. If you frequently feel dizzy, especially when changing positions, it's essential to consult your doctor to rule out any underlying conditions. Section 5. Fainting or syncope is when your body takes a time out. It's a sudden, temporary loss of consciousness that can be quite alarming. In more severe cases of hypotension, you might experience fainting, also known as syncope. This can happen unexpectedly, whether you're at home, at work, or out in public. Fainting occurs when your blood pressure drops so low that your brain is deprived of oxygen, causing you to lose consciousness. This lack of oxygen can be due to various reasons, including dehydration, heart problems, or standing up too quickly. This is a serious symptom that requires immediate medical attention. Medical professionals need to determine the underlying cause to provide the appropriate treatment and prevent future episodes. If you or someone around you faints, call for help right away. Ensure the person is lying down and elevate their legs to improve blood flow to the brain while waiting for emergency services to arrive. Section 6. Vision problems. Seeing spots or fading out. Another telltale sign of hypotension is blurred or fading vision. When your blood pressure drops, your eyes may not receive enough blood flow, leading to visual disturbances. You might see spots, experience tunnel vision, or feel like your vision is fading in and out. If you experience any sudden changes in vision, seek medical advice promptly. Section 7. Nausea and fatigue. More than just a passing feeling. Hypotension or low blood pressure can also manifest as nausea or fatigue. These symptoms are often more than just a passing feeling and can significantly impact daily life. Nausea, the feeling of wanting to vomit, can occur when your digestive system isn't receiving enough blood flow. This can be particularly distressing and may lead to a loss of appetite or difficulty in maintaining proper nutrition. Fatigue, on the other hand, is a general feeling of tiredness or weakness. It can be a sign that your body is struggling to function optimally due to low blood pressure. This overwhelming sense of exhaustion can make even simple tasks feel insurmountable, affecting your overall quality of life. It's important to recognize these symptoms and seek medical advice to manage them effectively. Section 8. Lack of concentration. Feeling foggy? Have you ever felt like your brain is in a fog, making it difficult to concentrate or focus? This lack of concentration can also be a symptom of hypotension. When your brain isn't receiving enough blood flow, it can impact your cognitive function, making it hard to think clearly or remember things. Section 9. Tips for maintaining healthy blood pressure. Maintaining healthy blood pressure is crucial for overall well-being and can prevent a range of health issues. Let's dive into some effective strategies to keep your blood pressure in check. While we've covered the signs and symptoms of hypertension, it's equally important to know how to maintain healthy blood pressure. Understanding these tips can help you lead a healthier life and avoid complications associated with both high and low blood pressure. Here are a few tips. Stay hydrated. Drinking plenty of fluids, especially water, can help regulate blood volume and prevent dehydration, which can contribute to low blood pressure. Hydration is key to maintaining the balance of bodily fluids and ensuring that your heart and blood vessels function optimally. Drinking plenty of fluids, especially water, can help regulate blood volume and prevent dehydration, which can contribute to low blood pressure. Eat a balanced diet. Consuming a healthy diet rich in fruits, vegetables, whole grains, and lean protein provides essential nutrients that support overall cardiovascular health. A diet high in potassium, magnesium, and fiber can help control blood pressure levels. Avoid excessive salt intake, as it can lead to high blood pressure. Consuming a healthy diet rich in fruits, vegetables, whole grains, and lean protein provides essential nutrients that support overall cardiovascular health. Engage in regular exercise. Regular physical activity helps strengthen your heart and improve blood circulation, contributing to healthy blood pressure levels. Aim for at least 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise each week. Activities like walking, jogging, swimming, and cycling are excellent choices. Regular physical activity helps strengthen your heart and improve blood circulation, contributing to healthy blood pressure levels. Manage stress. Chronic stress can negatively impact blood pressure. Finding ways to manage stress is essential for maintaining healthy blood pressure. Techniques such as yoga, meditation, or deep breathing exercises can be incredibly effective. Additionally, engaging in hobbies, spending time with loved ones, and practicing mindfulness can help reduce stress levels. Chronic stress can negatively impact blood pressure. Explore stress-reducing techniques such as yoga, meditation, or deep breathing exercises. These practices not only help in reducing stress, but also promote relaxation and mental clarity, which are beneficial for overall health. Explore stress-reducing techniques such as yoga, meditation, or deep breathing exercises. Get enough sleep. Aim for 7 to 8 hours of quality sleep each night, as sleep deprivation can disrupt hormonal balance and affect blood pressure. Establishing a regular sleep schedule and creating a restful environment can significantly improve sleep quality. Aim for 7 to 8 hours of quality sleep each night, as sleep deprivation can disrupt hormonal balance and affect blood pressure. Quality sleep is essential for the body's repair processes and maintaining a healthy cardiovascular system. Avoiding screens before bedtime and practicing a calming bedtime routine can enhance sleep quality. Limit alcohol and caffeine intake. Excessive consumption of alcohol or caffeine can dehydrate your body and potentially lower blood pressure. Moderation is key when it comes to these substances. Opt for herbal teas or decaffeinated beverages as alternatives. Excessive consumption of alcohol or caffeine can dehydrate your body and potentially lower blood pressure. It's important to be mindful of your intake and choose healthier options whenever possible. Staying hydrated with water and consuming a balanced diet can help mitigate the effects of alcohol and caffeine. Remember, if you experience any of the symptoms discussed or have concerns about your blood pressure, it's crucial to consult your doctor for proper diagnosis and management. Regular checkups and monitoring your blood pressure at home can help you stay on top of your health. Your healthcare provider can offer personalized advice and treatment options tailored to your needs. Don't forget to like this video if you found it informative and subscribe to the channel for more health-related content. Sharing this information with friends and family can also help them maintain healthy blood pressure and overall well-being. Stay healthy and see you in the next one. Remember, small lifestyle changes can make a big difference in maintaining healthy blood pressure. We're discussing a common health concern: hypertension, or low blood pressure. Many people aren't aware they have it until they experience symptoms. It's important to understand what hypotension is and how it can affect you. Blood pressure is the force of blood pushing against the walls of your arteries. When this pressure is too low, it's called hypotension. This can cause dizziness, fatigue, and even fainting. While these symptoms might seem harmless, they can indicate an underlying health issue. Hypotension can be caused by various factors, including dehydration, prolonged bed rest, and certain medical conditions. It's essential to identify the root cause of your low blood pressure to manage it effectively. Don't worry, we're here to guide you. In the following sections, we'll explore practical tips for managing hypotension, including diet, lifestyle changes, and when to seek medical help. Diet plays a crucial role in managing hypertension. Eating a balanced diet rich in specific nutrients can help elevate your blood pressure and improve your overall health. First and foremost, make sure you're adequately hydrated. Dehydration is a common culprit of low blood pressure. Drink plenty of water throughout the day, especially during warmer months or after physical activity. Increase your salt intake slightly. While too much salt can be detrimental to your health, a little extra sodium can help raise blood pressure. Add a pinch of salt to your meals or opt for salty snacks like pretzels or olives. Include foods rich in vitamin B12 in your diet. Vitamin B12 deficiency can contribute to anemia, which can cause low blood pressure. Good sources of B12 include meat, poultry, fish, and fortified cereals. Remember, making gradual changes to your diet is key. Don't make drastic shifts overnight. Consult a registered dietitian who can create a personalized meal plan tailored to your specific needs and health goals. In addition to dietary adjustments, certain lifestyle changes can significantly impact your blood pressure. Incorporating these modifications into your daily routine can help manage hypertension and improve your overall well-being. Engage in regular physical activity. Exercise is crucial for maintaining healthy blood pressure. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Consult your doctor before starting any new exercise regimen, especially if you have underlying health conditions. Avoid prolonged standing. Standing for extended periods can cause blood to pool in your legs, leading to a drop in blood pressure. If you must stand for long durations, consider wearing compression stockings to improve blood flow. Get enough sleep. Sleep deprivation can worsen hypertension symptoms. Aim for 7 to 8 hours of quality sleep each night. Establish a regular sleep schedule and create a relaxing bedtime routine to promote better sleep. Remember, consistency is key when implementing lifestyle changes. Start with small, achievable goals and gradually work your way up. Celebrate your successes along the way and don't be afraid to ask for support from friends, family, or healthcare professionals. Section 4. Recognizing warning signs. When to seek medical attention. While hypotension can often be managed with lifestyle changes and dietary adjustments, it's essential to recognize when to seek medical attention. If you experience any of the following symptoms, consult your healthcare provider immediately: severe dizziness or fainting. This could indicate a sudden drop in blood pressure and requires immediate medical attention. Chest pain or shortness of breath. These symptoms could signify a more serious underlying condition, such as a heart problem. Rapid or irregular heartbeat. An abnormal heart rhythm can contribute to low blood pressure and should be evaluated by a doctor. Confusion or difficulty speaking. These neurological symptoms could indicate a severe drop in blood pressure affecting the brain. Remember, it's always better to err on the side of caution. If you're experiencing any unusual symptoms, don't hesitate to seek medical help. Section 5. Partnering with your healthcare provider. Your journey to better health. Managing hypertension effectively involves a collaborative approach between you and your healthcare provider. Regular checkups and open communication are crucial for monitoring your condition and making necessary adjustments to your treatment plan. During your appointments, be prepared to discuss any symptoms you're experiencing, any changes in your health or medications, and any concerns you may have. Your healthcare provider can assess your overall health, perform necessary tests, and provide personalized guidance based on your specific needs. Remember, you are an active participant in your healthcare journey. Don't hesitate to ask questions, express your concerns, and advocate for your well-being. By working together, you and your healthcare provider can develop a comprehensive plan to manage your hypotension and improve your overall health and quality of life. Section 6. Embrace a healthier you. Take charge of your well-being. Managing hypotension is a journey that requires commitment and effort. By understanding the condition, making necessary lifestyle changes, and working closely with your healthcare provider, you can take control of your health and live a fuller, more energetic life. Remember, you are not alone in this journey. Many resources and support systems are available to help you along the way. Don't hesitate to reach out to your healthcare provider, support groups, or trusted loved ones for guidance and encouragement. Thank you for joining us today. We hope this information has empowered you to take charge of your health. Remember to like this video and subscribe to our channel for more informative content. Stay well.